welcome U.S. Secretary of Health and Human Services, Javier Becerra. Thank you, sir, for joining us.
Thanks for having me, Craig.
What do you say to people who say that COVID is not as prevalent as it was? The current dominant strain is generally milder than the prior strains. They don't have any serious health issues, and therefore they don't really need the new COVID vaccine shot.
Well, if you want to be safe, if you're not interested in getting sick and perhaps going to the hospital and perhaps dying, then continue to do everything we've done to stay safe and healthy, and that means getting vaccinated, getting tested, and getting treated if you do get infected, because while it's all true, we're in a better place than we were a year or 2 or 3 years ago, you can still get sick, you could still die. Let's get ready for COVID, get vaccinated.
The CDC Department of Health are no longer calling this a booster shot. What is the difference, and can you get this shot and gain the same level of protection if you never had a COVID vaccine shot before?
We've now turned the corner, right? It's no longer trying to deal with the COVID that we had. It's trying to stay ahead of it. And that means staying up to date on your vaccination, just the way we try to stay ahead of the flu season every year. It could be a different variant of the flu virus this year than last year. We just want to stay ahead of it. Same thing with COVID. Stay ahead of it. Get vaccinated. These vaccines work. They're effective. They can keep you alive and healthy and able to kiss your family members during the holiday.
Florida Surgeon General Joseph Ladapo is dissuading people from getting the new COVID vaccine. Here's what he said.
There's essentially no evidence for it. There's been no clinical trial done in human beings showing that it benefits people. There's been no clinical trial showing that it is a safe product for people.
How do you respond to that?
It's tough to respond to something like that, especially from someone from the medical community, when we know that the science and the evidence goes in the exact opposite direction, Craig. I hope that people will do what has kept them safe and healthy over these last 3 years. And typically that means vaccination, getting tested, and being treated if you're infected. When close to 700 million shots have been put into the arms of Americans for COVID in a vaccine, it tells you that Americans are listening. Don't change that.
How long does the protection last with a new COVID vaccine shot before it substantially wanes? In other words, if people are planning big travel plans and family get-togethers for Christmas or New Year's, should they get the vaccine now or should they wait a month or so?
So the rule of thumb here is if you haven't been vaccinated or infected in the last 2 or 3 months, then you're ready for the updated vaccine. The scientists, the doctors aren't saying you need to get one again in 3 or 4 months or 6 months. But remember, some of us have more immunity protection than others. And so for those who are less protected from something like this virus, you may have to get a vaccination later on down the line within the next year. But for most Americans, if you get vaccinated now, we think it's going to keep you covered not just for the fall and winter viral season, but maybe a little bit beyond. And then next year we'll talk again about whether or not we need to get updated again.
So we have the updated COVID vaccine. We also have the annual flu shot and RSV. If you want both, or really if you want all three, do you get them all at the same time or should you stagger them?
Yeah, again, there's where you want to talk to your physician as you're scheduling your vaccines. Certainly you want to be able to get all three at some point and talk to your physician about how you can best do that. But it is smart to get vaccinated for COVID, for the flu, and for RSV. I'll be doing that pretty soon myself.
Most healthcare plans will cover the new COVID-19 vaccine. Some may not, and many don't even have insurance. How can people who don't have coverage for this new vaccine still get it for free?
So the vaccine should be available to everyone with no cost out of pocket. If you have insurance, the insurance company should cover it. If you don't have insurance, we continue to have a program in place to help those who are uninsured be able to get that vaccine without having to pay out of pocket, because it's so important to make sure that you're protected. So if you don't know where you can go, most local pharmacies will be able to carry that vaccine so you can get covered. And if not, just go to vaccines.gov and you'll get the information you need.
Secretary Becerra, thank you very much for your time.
Thank you very much, Craig.